We can do surgery on the heart for many different reasons. The most common surgery is coronary artery bypass grafting. One reason could be if a person has blockages in the arteries that can't be fixed with stents. Then we would do something called a coronary artery bypass graft to take healthy vessels from elsewhere in the body and create routes for the blood to go through to bypass the blockage. Patients that have problems with the valves, which are sort of the doors that connect the different parts of the heart, either the valves can be very leaky or the valves can be tight or stenotic. Those patients might benefit from open heart surgery. Another reason why we might recommend surgery for a patient is in advanced heart failure, very extreme cases of a weakening of the heart.
In an ideal situation, you have a surgery. The next morning, they wake you up, they remove the tube from your throat, you're breathing on your own. By day 2, you're already up and walking. By day 3 and 4, you're with physical therapy, walking up and down the hallway, making sure there's no arrhythmias. And by the end of the week, you're out the door. The first 2 weeks are the most important period after having open heart surgery. And it's not because of the surgery, as it is more because of the incision. We have to make sure the incision stays clean and sterile.
When you have open heart surgery, it's a difficult recovery. You might not feel nearly 100% sometimes for days, weeks, or even months after.
If you're a patient that had open heart surgery, I think the biggest thing that you would benefit from is cardiac rehab.
The goals are really to get a patient back to feeling comfortable with their level of activity and perhaps even bumping them up to the next level of activity. So even if a patient is anxious about doing things on their own, this is a place where a professional is watching you. The medications that we use after cardiac surgery really depend on the type of surgery you had. For the most part, if a person is having a bypass surgery, that person can be expected to be going home on an aspirin, perhaps another antiplatelet as well, generally a cholesterol-lowering medicine like a statin, and also medications to control their blood pressure.
To avoid repeat symptoms or need for repeat operation or even repeat stents, we really tell people to take their medicine and start an active and healthy lifestyle.